Decline of cats, ANS 420, Group 2.
So declawing of cats was originally suggested in the Journal of the American Veterinary Medical Association back in 1952, and early studies referenced no long-term pain associated with the procedure. Many government bodies across North America and the world have banned the procedure or parts of it, and about a quarter of the cats in the US are currently declawed.
There are 3 common methods of decline a cat. The first is using guillotine clippers or a scalpel to remove the entire last phalanx, which is shown marked as the distal phalanx under the claw in this picture. The second is using a laser to cut through the tissue and vaporize it, still leading to the loss of the distal phalanx. The third method is not a true decline method, but it may need or may require decline having to be done. A tendinectomy is performed so the cat cannot control or extend its claws.
So some of the welfare concerns on declining cats is that it can cause emotional stress when they are not able to scratch. And so some of the common behaviors that cat owners sees is aggression and biting due to the frustration of not being able to scratch. Scratching is considered on using the muscles of forelimbs, shoulders, and torso. So deciding on declining will weaken the muscles. Decline can also cause pain in the paws, infection, nerve damage, tissue necrosis, which is tissue death, and back pain.
So the main stakeholders are going to be the cats who are actually having the procedure done to them. And then we also have the owners who choose to have the procedure done on their cat, and the veterinarians who help to inform the pet owner as well as to actually perform the surgery.
Some negative impacts of declawing include pain, limpness, muscle weakening, and emotional stress, and can also cause blood loss issues and blood flow issues, regrowth, and possibly paralysis.
So some of the benefits to having a cat declawed would be to minimize the risk for elderly, diabetic, immunocompromised, or other at-risk individuals who could be put into life-threatening situations if they had a cat scratch. There's also a decreased likelihood that the cats will then end up back in the shelters where they can face euthanasia due to overcrowding in the shelter system or just being kicked outside. And in some emergency situations, the partial decline can actually be beneficial if the bone and the toe surrounding the claw are actually infected, like if they were to have cancer.
Some alternatives to declawing include tendinectomy, which we talked about earlier, nail caps, which are plastic caps attached to the nails, which blunts them. They can be challenging to attach, so vets and groomers can often help with that. Frequent nail trimming also has a great effect by obviously removing the tip of the nail, but that can be challenging with wily cats. And better training, so by using treats or pheromone sprays to draw cats to scratching posts instead of your furniture, can limit damage.
Overall, we decided that decline is wrong, except in cases such as emergency surgeries for things such as a broken toe or cancers or growths. and declawing is also acceptable in the case of a human who is immunocompromised, hemophiliacs, or otherwise at risk from cat scratches.